endurance and stamina was reduced. I would find myself working, but then I would run out of energy quicker. Then breathing became an issue. Then sleeping became a bigger problem. The only way I could sleep was sitting in this chair at a 90-degree angle. They did a bunch of tests, and it was diagnosed as congestive heart failure.
Jules is a very unique patient. The main problem was that his heart was very weak, and he had actually two valves that needed to be fixed, the aortic valve and the mitral valve. And he also has coronary disease, and that needed to be addressed as well during surgery. Because of his weak heart, his kidneys were failing, and because of his history of tobacco use, his lungs were not in the best shape possible.
Jules is my buddy. When I met him, he was in the later stages of heart failure, was very sick and fragile, was just in the process of quitting smoking, and was at a time in his life where he realized how sick he was, and he was fully committed to do something about it and ready to turn his life around. I would see him a couple times after his hospitalizations and many times in between that.
At some points there was a couple of trips to the emergency room. I was treated with Lasix, which is a super diuretic, as you know. I'd be in 2 or 3 days, and then I'd be released, be out for 2 weeks, and then the reoccurrence of fluid would start again. So back in we would go.
His risk for surgery was very high because of his multiple problems. We had to approach his case as a team. In order to optimize his condition prior to surgery, he had what is called a balloon valvuloplasty.
Valvuloplasty is used for patients who have a severe blockage in their aortic valve. So it's not a valve replacement, but it's really a palliative procedure to help improve the blockage but not cure the blockage. After looking at his case carefully and deciding that if we could get him through a very bad bout of congestive heart failure and potentially give him a few weeks or a few months to recover, that he might be able to handle a much bigger operation of open heart surgery.
He gave up smoking prior to the operation, and then we felt, good enough and committed enough to him that we did the operation. There are 4 valves in the heart, and 2 out of those 4 valves were not functioning well in his situation. So we actually repaired the mitral valve, we replaced the aortic valve with a cow valve, and we did the bypass to the artery on the right side of the heart, which in its own self was not a simple, straightforward procedure. We had to clean out the calcium in that artery and then perform the bypass. Obviously, he was in the hospital for several days. He was very sick going in. He had kidney dysfunction, so he took a little time, but the team of our physicians and staff really did their best, so he recovered well.
Here at PinnacleHealth, we are very proud of our heart team approach. We meet every week where we discuss each patient in particular, and each doctor brings their own impression about what the best treatment is.
We look at their CT scans, their heart caths, and see what is the right treatment for that. We sit in the same room, we hash it out, we have a plan before we leave, and we execute that plan.
It always helps when you have more than one brain looking at things and then finding the best possible solution for each individual's patient problem.
After procedure, this is beautiful. I couldn't make it to the mailbox without resting, which is what, 30 feet? Now, you go out to the mail and get back and come back, and it was so nice to lay down in bed and lay on your side, not flat on your back, because I'm not a back sleeper, It was just great.
This is a man who probably was close to dying maybe 5 or 6 times in a course of a very short amount of time. And now he, for all intents and purposes, is going to live a long, healthy life.
He was willing to put in the commitment and the dedication that was required for this treatment to be successful. His wife was very helpful throughout this process as well. and we put our efforts in place, and he ended up doing very well.
So appreciative of his skills and talent that, it's made me better, and much better. Chances are I wouldn't have been here past Christmas without him. So, all the Pinnacle Health, all the people in that group, from the nurses' aides to the nurses, everything, were just outstanding and compassionate.
This man had such a fire in him, such a desire to live. I've never quite seen anything like it. He has his life back. I'm so overjoyed and so happy to see him not in a wheelchair anymore and not with the gray color in his face, and smiling and walking around and just looking healthy and living his life. It's incredible.
I tell you, I feel like $1 million, but I feel like $2 million. I really do.